Sorry.
Naubo ka ba?
No, no, no. Zachary, you go. Mom! Natakasan
Yung
siya.
itsura mo nakagano, no?
Guys, welcome back to my channel. If you are new to my channel, please don't forget to subscribe, turn on the notification bell for you to get updated for all my future uploads. By the way, my name is Raymond, your Pinoy nurse here in Ireland. Okay team, what's up? Nurse Raymond is back with another episode of our series Nurse in Action, wherein we put the spotlight on nurses here in Ireland to share their work experience and the situation in their respective wards, and of course for you to get an idea how is it working here in Ireland. So today we are fortunate enough to be joined by one of the admins of Filipino Nurses in Ireland Facebook page and one of the pediatric nurses here in Ireland. So yes, we are going to talk about pediatric nursing. So without any further ado, let's meet her now.
All right, guys, so we are back, and as I promised, we're going to talk about pediatric nursing. We are going to be joined by none other than Gale De Castro.
Grabe siya, oy. Grabe siya.
Hi, Gail. How are you?
Hi.
Kumusta?
Hi, Raymond. How are you?
Yeah.
I'm okay. I'm fine.
Subscribers natin are really asking for this topic, yung pediatric nursing. Kasi for sure, marami din mga pediatric nurses all over the world, not only in the Philippines. They wanted to know, paano nga ba mag-work as pediatric nurse dito sa Ireland? So before anything else, can you just give us some brief introduction about yourself and your working experience?
My name is Gale De Castro, and I'm a pediatric nurse or children's nurse here in Ireland. Actually, I'm registered as a general nurse. Yun yung consideration ng Ireland. If you are an overseas trained nurse, even if you're a registered general nurse here, you can still practice with your with a children's hospital. Di ba tayo sa Philippines, parang covered na tayo ng lahat. Meron tayong psychiatry, meron tayong community, meron tayong pediatric. Currently, nasa children's hospital ako, and I work with the heart center. So malalaman yun na kung nasa hospital ako kasi isa lang yung heart
Isa
center
lang naman,
dito.
Specialist hospital siya dito sa Ireland. How many years have you been working here in Ireland?
Kaka 3 years ko lang noong January. Pero I've been a nurse since 2010. Tapos nag-work ako sa private hospital sa city namin. And then I went to Saudi Arabia for 2 years as a neonatal ICU nurse. Pero na-expose din ako sa ward ng Saudi. So I know the bits and pieces there.
Yes.
And then when I came here, I was supposed to go to ICU, pediatric ICU. But then I was placed in the heart center. But anyways, I've learned a lot. I hated cardiac. Ayoko ng cardiac. Ayoko ng tricuspid valve. Ayoko ng mga atrium ventricle. Pero andito ako.
But I'm pretty sure you're loving your job at the moment.
And siguro I can't imagine myself doing something else other than nursing. When I joined the team, the cardiac team, it's just that na-realize ko kung paano ka-delicate pala ng mga cardiac patients na parang as young as a newborn, they go to surgery just to fix their heart.
Yeah, and also I'm curious whether the management that we do here in Ireland is same sa Saudi Arabia or even the Philippines. So probably you can give us some idea later on. And you mentioned earlier about all of us being registered as RGN pagpasok dito sa Ireland. But are you registered to a different division as well? Or you're working on it?
It's the same. So you're registered as a registered general nurse here. And then you can practice the children. Dito kasi sa Ireland, divided sila sa general nurse, which is yung adult na, at saka yung sa children's nurse. Kasi parang iba yung training nila. Kailangan at first magde-decide ka na whether you want to go general and children's or you just want to go to generals. Parang ganun ba?
Yeah. And congratulations kasi yung pediatric kasi medyo pag nadinig mo siya, nerve-wracking. For me personally, parang pediatric, mga maliliit na, alam mo yan, neonates and all that. Before you came here sa Ireland, what are the requirements they ask from you?
Almost the same as an adult hospital, like your CVs, your trainings, and your vaccines and whatnot, like as what you had before. I had the same thing. However, when you join the team, say if you join I have friends who joined the neonatal ICU team, they have to go to the neonatology course.
Okay.
If you go to ICU, you undergo the ICU course. And then say for us, we have our cardiac foundation course, which deals the diseases and the management in depth na. Kasi parang syempre you can research about it, but they have this course and it's part of your study days.
And all of
Yun yung
these
maganda dito.
are free, isn't it?
Yes,
So
exactly.
walang
Yes,
binabayaran.
exactly.
So that's
Walang binabaya.
yeah, that is very good.
Though I'm not closing my doors, I can be exposed to adults. It's just that I'm more comfortable with children. I know how to deal with them. Alam ko yung
Yes.
atake nila,
Ah.
whether this child would push me away or whether this child would scream at me. Parang ganun ba? So, alam mo na yun, at first it was difficult kasi parang syempre, hindi naman natin yung ginagawa sa Pilipinas, yung mga ginagawa namin dito. I
Okay.
can't imagine. Na parang sabi ko pa, oh, so these are the tricks na ginagawa ng mga children's nurse, and I didn't know about it. And it's nice because you get to, like, kunwari, if you know the patient, say your patient is Raymond, and then you'd be like, hi Raymond, ganyan, how are you today? I'm your nurse for today, and parang mga ganun ba. And then they get to know you, and then when you do your obs or your vital signs, you have the tricks of like, do you want to hear the birds chirp and whatnot?
Yes,
Parang
yes.
can I check your muscles? Mga ganun. So, hindi naman natin yung ginagawa sa Pilipinas. Sa Pilipinas
Yeah.
kasi, sige, trabaho na.
Totoo naman. I'm pretty sure enjoying yan. Kasi once in our life, we were like them. You know? We were
Exactly.
kids. The different thing lang, pasyente sila, but we are taking care of them. So how is your typical day? So paano ba yung duty ni Nurse Gail?
Usually, nagsastart naman kami sa ward namin ng handover ng 6:30. So, 7:30 yon or even 7:25 nagsastart na kami. So, usually, you get an allocation. Say, sa ward namin, you get either if you have a really sick child, you get 2 patients and then mag-isa ka. Or if you have lighter kids or like bigger kids. Kasi meron ka kaming, ang children's nursing kasi, it covers newborn to 16 years old. Yun talaga yung children's. But cardiac unit covers up to 18 years old kasi nga noon kasi hindi pa na manage yung cardiac cases. So yung mga kids namamatay lang sila at the age of a certain age. Now they grow as an adult. Ngayon hindi marunong, kumbaga pa hindi pa marunong yung adult hospital dito to manage these teenagers who's like yung shifting ba ng bata, ng child to an adult. So we still manage up to 18. So basically, pag ganon, you get lighter kids, you get 4 or 3. You go to their rooms and, of course, introduce yourself. The parents are essential sa children's nursing kasi you just don't deal with the patient. You also deal with the parents, say, if they're anxious, if they're frustrated about their children, you get to manage them as well.
So the parents stays in the room with the patient. Okay.
Or, some parents would leave, like, late evening because they have other children at home to look after too as well. So tell the parents the plan. Like during handover, the plan for the day. Yeah. And of course, you also need to ask the parents what are their plans. Like, would you be...
Talagang siyang hand in hand din.
Yes, kasi nga, they are involved in the care. There are parents who give feeds through the tube, who gives feeds through their peg gastrostomy, who gives them a medication. Like, you hand the mom the medication because she gives it. But like, they do stuff that can be done by nurses, but they're actually taught to do it just so they can be, it is a collaborative care between the healthcare and the parents as well. Parang ganon.
I think that's one of that we can state the difference between, the practice here in the Philippines. Kasi sa Pilipinas, di ba, nurse, trabaho mo yan, di ba? Pero
exactly.
Talaga. That's really good.
Parents would know their children so well. We know the medical things, but they know their children from head to toe, I guess. Parang ganon.
Totoo naman, totoo. Are your patients usually connected to the monitors?
Yes, because they're cardiac.
Okay.
Just because they're cardiac. Some other wards, hindi sila connected sa monitor. They're not connected to the telemetry. Pero kami, connected lahat sa telemetry. Kasi nga, we don't trust.
Anything can happen.
We don't trust the cardiac patients. Yeah.
Totoo naman, totoo. Exactly. Try daw nga minsan ng mga cardiac cases. Di ba? Having said that, what are the usual cases that you handle?
Upon delivery, usually alam na ng mga doktor yung diagnosis kasi meron tayong antenatal diagnosis or yung habang buntis pa yung mom, alam na nila yung diagnosis. So, alam na nila kung paano talaga yung manage. Tatawag na yung maternity hospital sa amin that we are booking a child who has a hypoplastic heart. Yung patients kasi namin, if they come at this age, say newborn, sigurado kami magkikita kami at next stage.
Yes.
Because like say hypoplastic heart syndrome, hypoplastic left heart syndrome would have like several surgeries. So they get surgeries at 6 months and then at two
Yes.
years old. And
You mentioned about the collaborative effort or management. So we have the parents, we have the nurses. Sino pa mga members ng team?
the main man are the nurses and the doctors, tas yung parents. Pero syempre, of course, collaborative care din siya involving our our pharmacist, physiotherapy if they had surgery, chest physiotherapy if like if they have like respiratory concerns, healthcare assistants, they're also involved, social worker are also involved kasi nga they cover, like say the patient needs the medical card or the parents needs assistance, say even like transport to home.
How well supported
And
talaga ng
yes,
hospital
yun
mga
nga.
patients din?
Actually, yun yung maganda dito sa atin, di ba?
Yes, oo.
Parang, like we have, like kunwari may problema sa feeds, meron kang tatawagan. Parang ganun. And we also involve the public health nurses who does the follow-up. Like, kunwari, titimbangin yung mga bata.
Ang dami niyang trabaho dyan, no?
Na-feel mo yun? Biglang ganun. Na-feel mo yung pagod ko? Yung araw-araw talaga. And where is Gail? Who's the one minding ganito?
Yeah,
Parang
oo.
gano'n. Kasi hindi lang naman, kung cardiac kami, hindi lang naman cardiac doctors ang
Totoo,
naghanap,
totoo.
ang nandun. Involve ang
lahat
neonates. Involve ang endocrine pag meron sila. Respiratory, plastics. Like, kunwari meron silang cleft palate, pero cardiac sila. Tapos nag-cleft surgery sila. I-involve mo pa yung plastics.
Multidisciplinary talaga. That's good.
Talaga.
Yeah. So,
Sige,
sabi mo ng
pagod.
pagod. So, how many hours ba ang duty mo, usually?
12 hours.
12 hours. So, half seven until half seven. Okay.
Kami lang ata ang hospital na 14 shifts a month.
Kami din naman, no? Joke lang.
14 din ba kayo?
14, 15.
Pero other children's hospital kasi, alam mo na yung ibang,
Yes,
13 lang sila.
Per month.
Sana all.
Yeah, and just to give them an idea, for sure, they will ask about the break times. So, ano ba yung mga ilang hours ang break nyo?
Ang maganda lang kasi sa team namin is that our managers and like yung mga kapwa nurses namin, ipupush ka talaga mag-break. Like, no, you go for break. No. What can I do? Minsan kasi, di ba, syempre, pag stress ka na, no, I don't want to go for break. I want to finish my job.
Finish everything, yeah.
Sasabihin nila, no. You go for a cup of tea or just go there. Just go. Have a break from the ward. So you'll get like an hour break for lunch and then half an hour for breakfast. So yun yung for day shift.
I just wanted to ask as well, syempre, hindi lang naman puro gamot ang ginagawa natin, hindi lang puro gazing. So, anong usually ginagawa nyo in the morning? Nagpapaligo din ba kayo ng mga pasyente or
I don't know if it's just here. Hindi kasi dito pinapaliguan ng bata araw-araw.
Okay.
Biglang gano'n, secret ba yun? Secret ba yun? Hindi. Nililinis naman namin sila, but not the full bath. So we can do like a bed bath or a sponge bath sa bed. Pero depends din sa condition nila. Parang ganun. We have our play therapist. I forgot to mention. We have our play therapist.
Really?
Malalaki ang sahod nila.
Talaga ba? Pwede ba mag-apply?
So sana all. Yung mga play therapist, ang ginagawa nila, say for example, they show the child what's gonna happen. They have a toy, tas kunwari, lalagyan nila ng IV cannula, or lalagyan ng dressing, kasi kunwari, surgery, open heart surgery, so kunwari, may dressing sa sternum, yung mga ganun ba. So,
na-mention mo kanina yung pag-take ng OBS, no? Hourly ba kayo nagtitake ng OBS sa cardiac unit?
It depends. Pag close monitoring kami, like say, if may infusions, you do an hourly OBS. However, we do 4 hourly OBS a ward.
Okay.
But if they have like chest drains, because we take cardiothoracic patient as well.
Sa nursing documentation, computerized na ba kayo doon?
Sa ward namin, yes, computerized na kami. Pero ang may mga natitira na lang yung sa mga OBS or medication, cardex, at saka yung fuse chart.
Siyempre may mga cases na hindi tayo familiar, or you personally. How do you cope with that?
We collaborate with our clinical nurse facilitators or yung educators namin. So they get to provide us information regarding that cases and what to look for, or like, signs of deterioration, yung mga ganyan. For myself, I also do my own research. Kasi syempre, iba din talaga yung parang first hand na ikaw yung magbabasa, malalaman mo.
And of course, you mentioned earlier about the study day. So it's also important for
you
to
exactly.
update yourself. Lalo na sa nursing practice dito sa Ireland.
Mm-hmm.
Diba?
Ang maganda kasi dito, you can always ask the doctor.
Mm.
Like, you can always talk to them, and even the consultant, you can ask them, like, say the consultant was Raymond, you'd be like, Raymond, I don't understand what's happening to this patient. Equal kasi dito, hindi dahil
Totoo.
consultant siya or
Yes.
nurse ka,
Yes, yes.
hindi ka na parang makakalapit. Pwede mo kang kausapin yung consultant na, can you speak to the parents because like, hindi sila parang they're frustrated, parang ganun.
And working here for 3 years, Nurse Gail. So ano ba yung mga major adjustments?
Maka-nurse.
na
Maka-nurse. There's always a standard operating procedure that you can always check. There's always a policy. There are always resources na available. Yung mga tao na nasa team, yun yung available. Ang mahirap lang sa akin at first is the language. Kasi nga parang sinasabi natin na, it's English naman siya, ba't hindi ko siya maintindihan?
Correct.
Like,
Yeah.
yun talaga yung struggle ko. Yung parang nung first days ko, sabi ko pa, English, okay lang man. Nakakaintindi naman ako ng English. Pero bakit at the end of my shift, lagi akong pagod, exhausted ako. Lagi ko iniisip, ano kaya yung sinabi niya? Hindi ko maintindihan. Yung parang ganun ba?
Yeah.
At saka meron silang mga slangs that parang,
ano daw?
parang sasabihin, he got sick. Parang ganun. Oo nga, kaya nga siya nasa hospital kasi he's sick. Hindi pala. He got sick is
Susuka
parang
pala
sumuka
siya.
pala.
Yes,
Parang ganun sabi. Abangan nyo sa aking vlog.
Yun.
Meron akong upcoming vlog regarding medical terms na slang
It's really good
sa
here.
Ireland.
Regarding sa pag-deal mo sa mga co-workers, syempre dito sa Ireland is really known for being diverse in terms of nationalities. So, paano ka nagdi-deal sa mga ka-work mo?
I think you just have to be a team player. Like, kasi iba-ibang personality.
Mhm.
Merong iba na pag nag-work siya, tahimik lang siya. Merong ibang nag-work na habang ginagawa niya yung mga ginagawa niya, nagsasalita siya. So like, it's how you deal with them differently.
Yes.
Para mag-coincide kayo. Because at the end of the day, what is our goal? Our goal is to keep our patients safe.
That's
Number
correct.
2 is to keep ourselves safe, like our license and our practice safe. Because you have that goal, the team is working on it. And each one of you would adjust. And Irish nurses are really good. We get to understand each other. Like say, parang kunwari, may isang nurse na parang na-feel bad. Lalapitan ka talaga, tsaka kumusta ka, are you okay? How do you find it? Like parang emotionally.
And they don't invalidate your emotion. They do not invalidate
exactly.
your emotion. Yeah.
That's what you get, I think, with working with Irish nurses as well. They're really good with like dealing with emotions.
So job mo as pediatric nurse, let's link that to the current situation. Alam naman natin that we've been dealing with COVID for the past, 1 year na ata no? So how you cope with that?
Mas naging apektado kami this later part. Ngayong third lockdown natin. Marami ng mga teenagers involved, which we cater. So, yung parang magsasabi lang sila, I have a funny rhythm in my heart. Inaatake kasi ng COVID. Yun yung napansin namin ha. Pag adults, respiratory. Parang ganon.
Yep.
Pag children's, it's heart.
Pero ano pa rin naman, supplied kayo ng mga PPEs. So okay kayo.
Nung first lang, medyo mahirap. Pero ngayon, okay na kami. Okay.
That's good. On a lighter note naman, Gail, working here in Ireland for 3 years, so ano na bang nabago sa'yo? How did Ireland change your life so far?
Ang pinaka-goal ko kasi noon is to bring my parents abroad. Like, alam mo yun, mag-travel.
Yes.
And then I get to do that. So one of the fulfilling things yun para sa akin. Parang napapunta ko yung parents ko dito. And of course, I get to be exposed to other nationalities. And I get to travel. Parang I get to travel Europe. So, nakapag-travel na rin tayo
Sana all.
Sana all.
So we can say that
affordable ang ticket.
Totoo. So we can say that these are the perks of being a nurse here in Ireland. Isn't it? That's very nice.
Oo naman.
Of course, guys, as you know, Gail is one of the admins of Filipino Nurses in Ireland Facebook page and a YouTuber as well. So may channel siya, we call it Gail DC.
Nag-start ako sa wala lang. Gusto ko lang mag-video. Tapos parang nakita ko yung purpose. Kasi parang naisip ko, if I talk about NMBI, mas madali. Kasi laging may nag-PPM sa akin asking about how to apply sa Ireland, how to apply sa NMBI, ganyan. So basically, my channel is about NMBI application, your Irish nursing. Ano bang meron dito sa Ireland? Like, their shopping, their tourist attraction, parang ganun.
I will put the link of Gail's channel dito sa video na to. You will never go wrong of subscribing to Gail
Grabe
DC.
siya.
Okay, so please do not subscribing to Gail DC. Okay? Alam nyo, dun sa Filipino Nurse in Ireland, dun ako nag-umpisa. Alam mo yun? Nung naisip ko na mag-apply dito, sa mga pangalan nila, nakikita ko na yan, Gail DC, sino pa ba? Golda, Michael. Yung mga nandun, yun yung mga naging inspiration ko din. Why I started my channel. Kaya, di ba, kung ano nung pinaggagawa ko. Dahil sa inyo din. No, serious.
It's naman, two-way naman yun eh.
Yes.
You get to inspire us as well. Like parang yung mga applicants, when they say that they're very, very happy and they're motivated.
Gusto ko yung sinabi mo din sa, I think sa Facebook, na help me help others. So that's really
Yes, exactly. Oo. Kasi parang
good.
na-realize ko because I don't have all the answers. Payback time ba? And
Yes.
Pay it forward. Kasi ako tinulungan lang din naman ako. Because I have an overflowing help and support, I get to help others as well.
And one last question, bago natin i-end tong video na to, what are your tips sa ating mga aspiring nurses?
Just go for it. If you feel like this is for you, just go for it. And si God naman ang magde-decide nun eh. If this is for you, this is for you. And if it's not for you, maybe there's something else. Like maybe Ireland is not for you, but Australia is for you, or Canada is for you, or even just Philippines is for you. Parang ganun ba? You just have to try because pag hindi ka nag-go for your goal, you'll be stagnant. There's more to life than Ireland, guys, okay? Though Ireland is a good choice, kung hindi ka nakuha sa Ireland, there are other countries. Even staying in the Philippines with your family is a good choice still.
Gail, once again, thank you so much for your time. Okay, so once again,
Thank
guys,
you so much, Nurse Raymond.
Or you're welcome. And guys, we have talked about pediatric nursing, and I hope that you like this video. And if you haven't subscribed yet, please do so and follow my Facebook page, Nurse Raymond 123. Okay, see you soon again, guys. Bye.
Bye. Thank you. Bye-bye.